1 hour busy, but then somehow you people are making me do this again and again. So thank you so much for that. And our reading and studying and sharing and exchanging of knowledge is happening in the very, very soric way regularly. Thank you, universe, for that. And now, once again, welcome you all to the reading club. And now we are into page number 135. We are reading about the psychosis now, about the psychotic mentals. Yes, and every day, all of us have lot of psychotic cases coming in. All the so-called, what do we say about that? The thyroid issues, the hypothyroidism, the diabetes, the PCOD. What do we commonly call about that? Like the
lifestyle diseases.
Lifestyle diseases, yes. So that is the psychosis. Lifestyle is nothing but the psychosis. And now either we have to come back to the soric levels, but then people have forgotten the soric levels now. What is the sora? And that is not enough for us because everybody are greedy and greedy for money, greedy for materials, greedy means what? Like that avarice comes in, that too much of greed is there, like more than what they need. Yeah, more than what they need. So that is the biggest problem now we are all facing. When we crave for more than what we need, automatically there will be accumulation of all these products, like cholesterol will be accumulated unwantedly here and there in the arteries, and sugar levels will be more. Isn't it? The thyroid levels, T3, T4 and all will be high or low according to our psychotic mentality. All the day-to-day, all the lifestyle diseases set in. So we are exactly there today. So are we all ready to read the book? Yes. Please follow me closely through the lines. So that is page number 135. This is very, very interesting. Daily we see young children who have compromised their sora and going into early psychosis. This is what we are dealing with here today. Psychosis precipitated in young children by parents. Yeah. Many of us are parents here, so it is an eye-opener for us too. In the modern competitive world, the parents in the first place are averse to having children. Yes. How many of you are seeing such things in your daily life, in your daily clinical life now? Children don't want to get married. No, children means of the marriageable age. They are into past 20, 21, 23, 24, 30, 29 years. They don't want to get married. They don't want to take the responsibility, or they have something else, some inferiority complex or some confusions regarding marriage. And those who are married, they are having averse to children. They don't want children, no? Like marriage is a contract. So between the husband and wife, they always keep that contract of, no, we don't want children. And that is one criteria for marriage. If the groom or the bride, yeah, they will be having that kind of a discussion between them. If you don't want a child, come on, let us marry. Yeah. Is there any rubric? For all, we're trying to gain knowledge by excessive viewing YouTube knowledge, video and getting spectacle. That is an addiction. Yes. This watching YouTube and all is an addiction. Of course, all these technologies are good, but then you have to use it in the soric way. For knowledge, if you use it, but anything soric, and too much of soric can also be syphilitic. So anything without proper sleep, without proper rest, not taking food properly, and full time into the YouTube, even for knowledge, can be a bad thing because you cannot punish your body. So with that proper sense, no, like we in Malayalam, we used to say, Amidamanal Amrutam Visham. Anything when it is taken in more quantity, even Amrit for that matter, even if that Amrit, what we say that in English, Amrit, nectar, what is that? Okay, so
nectar.
Nectar, yeah. Even if we take that in too much of quantity, it can become a poison. So that is it. So whatever you are looking into the YouTube, that also should be in a limited frame. Then it is okay. So here, yes, aversion to having children. Okay, if at all, see, we will get such kind of cases in our clinic, and what do? We just give them a GCS, and after that, somehow the hormones get stimulated, or their ideologies are getting reversed, or that is getting corrected. some perversity will be there in their mind that will be getting corrected automatically with the GCS, and this patient will be ready for marriage for the first time after taking our single dose. Or if they are married couples, they will be having that reversal of their whatever anti-social, anti-nature, some thought process will be there, no? Like marriage is for offsprings, for producing offsprings, and that is how our species is continuing on and on. So if they decide that we don't want children, both of them being physically normal or hormonally normal, reproductively normal, still they don't want to have the children, it is their decision. That is page number is 135. Yes. Then what is that? When we give the medicine, when we give the right medicine, the GCS, what happens? Again, their ideologies will get fixed into the proper way and they will want to produce offsprings. So this we generally see in our clinic. We cannot jump into conclusions. It can be confusion of identity. It can be aversion to marriage. But for what reason is it? Aversion to children. But for what reason it is? Is it fear of responsibility? Or is it due to some complex or some fear of some misfortune or fear of sufferings, fear of pain? Many ladies do have such kind of pain, such kind of fears in their mind. Like how will I go through the labor? Even cesarean section, that will be painful. I cannot tolerate pain. They are mentally, they are having that fear in their mind. They are afraid. So give them that positive, what to say, that counseling. 5 minutes counseling is enough, but then you have to give the GCS. You can even take 1 hour to prescribe the GCS. With that GCS, whether you give the counseling or not, the fear complex, etc., will be taken care of, and the baby will be implanted, and the parents will be ready to grow the baby. So, if at all they have one child, they do not have time for the children. Such an unwanted child never gets love from either of the parents. I am reading page number 135. Okay, so this is how parents are bringing up the children nowadays. Previously, in our childhood days or in our parents' childhood days, every couple were having how many children? Some 13, 14. Parai petta pandirukulam. Like in Malayalam, that saying goes. Everybody will have a dozen children, minimum 12 or 13, 14, even 20. So they will be producing the kids in a year, they will be producing one child. So this is how it was. And at that time, there were so many deaths also, no? Like the mortality rate, the child mortality, infant mortality rate was high. Maternal mortality rate also was high. But then the family used to run very, very sorrowfully at that time. Nowadays, everybody have got everything. There is no scarcity for everything. In fact, everything is available very easily in a very effortlessly. But it is our decision, or it is the decision of that couple. Either they don't want to marry, or if they marry, they don't want children, because too much of comforts and they don't want to compromise anything. Even for their own offsprings, they don't want to compromise anything. That is why they decide that you people were all fools. You did not live your life. You lived the entire life for your 10 children or for your 5 children or for your 3 children. Now we don't want children. We want to enjoy the whole world, etc., etc. We want to do traveling. Even if the young couples are, they have kids, but then they will not take the kids while they are traveling. What they do, they will entrust their kids to their parents. The children will be left to the grandparents' home, and the husband and wife will go away for the tour, etc. No, because they don't want to compromise their comforts. Very, very psychotic world indeed, no? If at all they have one child, page number 135, okay? They do not have time for the children. Such an unwanted child never gets love from either of the parents. The psychotic parents, both father and mother, are busy accumulating wealth. They think money and comforts is all that the child needs. The maid look after the needs of the child's nutrition and body care. The physical needs may be satisfied mechanically, but what the human child also needs is love, care, and attention, which are all soric, okay? Which should be motherly. And that is again purely soric, which nobody else can give. So there can be tens of mothers, but then there can be only one pettamma onne ullu, like we say in Malayalam again, no? Like there can be several mothers who will take care of the child, but then the biological mother will be only one. So this 5 to 6 years child may be exposed to best tuitions, best school, best education, but it is also exposed to some turmoil at the home. the father and mother, who also do not have time for each other or who do not vibe with each other, have daily quarrels and fights, sometimes even physical. So there can be a lot of spelling mistakes between the relationship of the parents, father and mother. They are daily quarreling. The child doesn't know for what reason these parents are quarreling. It can be because of professional jealousy. You are earning more than me. Nowadays, ladies are earning more than men. So ladies always have that ego. Okay, I am earning more than you. I am working more hours than you. And why can't you take care of the child? Why can't you make a tea for me? This will be the question of every wife who comes home late in the night. And the husband will be sitting there with the TV remote on, and he is not even going for work, but then he can't take care of the child and he will not be doing the cooking. So where is the balance here? See, marriage means, or maybe in our Indian scenario, the patriarchal culture was there since many eras. But then but then now the changes are happening. Now women are very much they are forthcoming and they are in the upfront, and everywhere in whatever domains you see, ladies are there equal in par with the male counterpart, or even a little bit more than them. So now this is the confusion of this generation. Many children, many young boys, they are developing gynecomastia, or they are like, their voice will be like females, and they are very timid like females. They behave like the normal females, and the testosterone levels are so low, and even the phallus growth is, that will be like microphallus, and the reproductive capacity will be very less. Even they will be having azoospermia. They will not be having the mustache or the secondary sexual characters and all that. How many of you have seen such cases, such endocrinal disorders? And and um, even the bisexual thing, or the perversity of the mind, the homosexuality, etc. No, all these are coming up more and more because of the kind of gender equality and the confusion in the genders, confusion in the sexual identity. And females, they are all having hirsutism. How many of you don't have hirsutism? How many of you don't have the PCOS syndrome? So this will be the question now. Why? Because of the packages happening in the beauty parlors. Previously, we all used to do only one threading. That's all. But now it is all about the facial hair removal. Why? It has become a package, a part of the package, which means what? Upper lip one, this much of money, and then the chin area, the entire face, because every lady is having the upper lip problem and the chin problem and the whiskers area, the hair growth is there, the hirsutism is there. Even though they are all having the normal menstrual cycle, of course, many of them may not be having the normal menstrual cycle, but they are all achievers. They think that they are achievers. What do they achieve? They achieve a good name in the society, that this girl is earning 2 lakhs per month. Her salary is 2 lakhs per month. And what do you earn? They will ask to their sons. So this is the era now. It is a changing era. That's what we say, that this is Kali Yuga. Whether you believe or not, but then you all know that you are all having that lack of time, as if the world is rotating very fast. The earth is rotating very fast. Although there is 24 hours in a day, how many of you have that full 24 hours in your hand? The moment it is morning, the moment it becomes sunset also. How fast the days are moving. And even the small child who is born on the earth does not have a time for itself. And even the parents don't have time for the child. This is exactly what we are reading now. The father and mother, who also do not have time to each other. We don't have time to give that proper quality time even to our spouses. We don't even sit and talk to our spouse. What did you have today? That care, that exchange of good words, that is not there now. Why? Because I am busy and you are even more busy. Whenever I come home, you will be in the mobile phone. Whenever you come home, I will be in the mobile phone. And this mobile phone, you cannot do without that. Why? Because everything is coming in the mobile only, no? Without mobile, you can't have a life. Then what life are we all dealing with? Are we all dealing now? That is the biggest question of the era. So actually, there is no answer for that. World is going into the psychosyphilitic, and it is fast moving towards the syphilitic. The father and mother, who also do not have time for each other or who do not vibe with each other, have daily quarrels and fights, sometimes even physical. The poor child watching this silently is petrified. There is a sense of insecurity. What if my parents divorce? See, in the West, Every parent will be in the school. When we talk to the children of the children in the school in the West, almost all 99% of the families will be, the husband and wife will be staying separate. They use the word as split. Are your parents split? Yes will be the answer 99% of time. That 1% chance is that they will be Indians. They will be Indian parents or some or Asian parents. In the West, everybody, every spouses will be separate only, and the child will be staying 15 days with the mother and 15 days with the father, or vice versa. And these children are forming a gang. They know that every other child is going through this. Are they split? Are they broken up? If they are not, then they wonder, your parents are still staying together? Yeah, because my elder brother's children have suffered this. They are having a good family, luckily, because we people are Indians and we know the family values. And the other children were wondering in dismay, like, your parents are staying together? How lucky you are. So what if my parents divorce? So this every child is going through now in this psychotic era. The child is sensitive to all this and weeps. Why the child weeps? Because the child is still in the soric phase. It is helpless and it doesn't know how to react, and it gets frightened and it weeps because of his predominant sora. The timid constitution is sensitized every day and weeps until the tears dry up. He tries to pacify the parents in his own way. Now here comes our carcinosinum. Here comes our mad carb. That orphaned feeling will be there. The magnesium group will be there. Yes? But for him, he is trying to change his parents, which he can never succeed. They are blinded by their egos. Who? The parents are blinded by their egos. The poor child's primary reaction of weeping and pleading to the hostile stimulus of parents' fights has failed. Now he mentally shifts his gear of defense. He is as if orphaned. He decides to grow on his own. He knows that there is no father and mother for him, although they are physically present. They don't have time for each other. They are always fighting. They don't even care for me. How will I grow? Maybe with the help of the grandparents, I will grow. And of course, this child will not be having any love towards its parents, because the child did not get any love from the parents. And if it is a carcinosinum child, how will it react? If it is a lyco child, how it will react? And if it is a magnesium group child, how it will react? These are the predominant thing which is coming under the orphan rubric, or in the childhood turmoils, where the child is trying to pacify the fight between the parents. Carcinosinum child will never keep the grudge in himself or herself. Even when it grows, it will consider it as his responsibility, his or her responsibility to take care of the parents, although the parents have not fulfilled his young childhood days desires. Carcinosinum is a very, very mature child. It is a precocious child. It goes into early maturity and into early childhood days only to pacify the parents. The life of carcinosinum is the life of the parents. Carcinosinum does not have an independent life at all. It molds itself, molding how much ever it can mold. It will mold itself again and again, so that my mother will smile, or my father will not quarrel, or my father will not beat my mother. So I will do like this, I will do like that. So this is how a carcinosinum child molds itself, because it wants that perfect peace and harmony in the family. Again, its sensitivity will be brought out in the form of artistic talents, no, like neatness, cleaning everything, removing everything from the shelf and again keeping it in stacks, helping the mother, etc. It's not the typical carcinosinum child. And it will be having that ragas, the knowledge of the ragas or the songs of or the classical dances. The moves will be very graceful for carcinosinum. Yes, this is how a carcinosinum child will be formed, a kind of suppressed child, and who has to take the responsibility well early in its childhood. Taking the responsibility early in the childhood. Carcinosinum is almost the only drug there. And let me take you to a case here towards this rubric and towards this medicine carcinosinum, where I have cured a case of PCOS with hirsutism, very bad levels of hirsutism, and there was no periods at all for this girl. Very nice girl of around 21 to 22 years old, and she was not having menstruation at all, and her entire body was covered with thick horse hairs. Not only the face, Not only the whiskers area, the mustache area, the beard area, the chest levels, and even her thighs, the abdomen, everywhere it was like manly hairs. I could not do anything to remove the hairs. She is doing that, removing that mechanically, but she has got a fantastic husband and she has got 2 kids after carcinosinum. After carcinosinum. So after carcinosinum, what had happened? The period cycles became normal. The female cycles picked up. The 5 hormones of the ladies, no, like estrogen, progesterone, FSH, LH, all these hormones were in line, and she started ovulating for the first time, and the menstruation had happened in the correct regular intervals, and naturally she conceived, and naturally she delivered normal vaginal labor. And she is even now grateful to me for giving her that 1 dose of carcinosinum. And I am even more grateful to the universe for opening my eyes to give carcinosinum to this wonderful, wonderful child who has got that typical textbook symptoms of carcinosinum. But the way I entered into this case was like responsibility early in the childhood. The father was a drunkard. They are of Iyengar family, okay? The father was a drunkard, and he used to come and make all sorts of galata in the home. The poor mother will have to suffer a lot. And this child is the eldest child, this young lady, and she has got a younger sister. She used to take care of the younger sister, who is some 2 to 3 years younger to her. And she used to take care of her sad mother as well. And she used to take care of the drunkard father also. The entire home, she used to work, she used to go for work, and she used to take care of the pet dog also. What is the remedy? Carcinosinum. 1 m single dose. Now, why 1 m here? Generally, yeah, this carcinosinum is nothing but it's a nosode, right? Nosodes better to give in the 1 m potency. Tuberculinum, syphilinum, morphinum, whatever nosode it is, better to give in the 1 m potency. Somewhere I have read about that. And this 1 m potency acts fantastically, okay, rather than 200. Carcinosinum 1 m single dose works through the case, and it corrects the case so beautifully, like the blossoming of a young bud into a full-blown rose, no? Like how beautifully she lives now with her husband and with her young kids now. The young kids are all grown up now. Now coming to magnesium group. Magnesium group again very much repressed. What do you mean by repressed? It is not suppressed. Carcinosinum is suppressed. Staphylococcus aureus is suppressed. Ignatia is suppressed. Sepia is suppressed. But magnesium is not suppressed. It is repressed. It doesn't know even that it is suppressed. It can't even understand that it is suppressed. That is the feeling of magnesium, which means it has accepted. It is born orphan. When it in carcinosinum, it knows that it has got a father, it has got a mother, and it is my duty to take care of them. They are having bad chemistry due to some reason, but I am their child and I have to take care of them, is the feeling of carcinosinum, and it never has any grudge. Whereas magnesium, it doesn't know the meaning of grudge. It doesn't know the meaning of suppressed. It is born in the orphan family, or born orphan, even as a baby. I have seen a video. A small baby, an infant who is lying in the cradle, some 4 months old hardly, and the child knows everything in the planet. The child knows everything in the planet. That my parent is not there, my father is not there, my mother is not there, and I am in the care of a maid, a lady who I don't even know who she is. I am only 4 months old, and I am helplessly lying down in the cradle. This is the picture of magnesium. Helplessly lying in the cradle. Somebody else, not my biological parent, somebody else is taking care of me. What is this feeling? This is the feeling of orphan. And here that child will not cry. Why? It does not have a parent. No, who will come to protect me? Because that suppressed feeling is not there. If there is a suppressed feeling, the child can even cry. Alone, at least alone, the child can cry. If it is repressed, what is the meaning of crying there? There is nobody to help me. I am already in the hand of some putani. Some putana is taking care of me. That is it. So and in this interesting video, kind of sad video, the so-called lady, whoever is taking care of this child, she is shouting at this child in a very harsh voice. Huh? That was the video, okay, what I have seen in a reel. So she's shouting in a hard voice, like titifying, that it is scolding the child's parents. Your mother, she went there. Your father, he went there. And the grandparents, nobody is there. Like that, she was scolding at the heights of her voice towards this child. And the expression of the child was shown in the reel. That is the magnesium reel. The child is in shock. The child is afraid. The child has got that helpless feeling and that enormous amount of some kind of a suffering on its face, and it knows that it is orphaned thoroughly, and it knows that it is into some danger, but then there is nobody to help him out, and all these expressions are there on the face of a 4-year-old 4 months old infant. That was the fantastic magnesium group. So in the reel, so if you have such kind of reels or anything, no, like interesting thing, you can always share in the group and we can have a discussion upon that, what medicine it could be. No, without any case history, you will be able to crack it down with one dose of the GCS. How the child will be passing the stool, it will be of what color? It will be like scum on the frog pond. It will be greenish diarrhea, and and the face is chubby, and there will be sweat all around, and the hair will be stuck to the scalp. You will be giving mag carb, right? Magnesium carb, uncomplaining child, contented child. Why is this child contented? It is not the syphilitic contentment. It is the psychotic contentment, because the child knows that even if I cry to the hell out of my throat, nobody will come to save me. So that is why the child is contented. Okay, if you give me milk, okay, I'm happy. If you don't give me milk, I'm happy. If you give me pacha vellam, if you give me water, I'm happy. Hmm? If you give me anything, I'm happy. I'm okay with that. So this will be the attitude. Very, very nice child, no? That is magnesium carb. And why is the hair stuck to the scalp? Because of the suppression. Wherever there is suppression, you will be seeing that. Especially Vijaykar sir talks about magnesium carb as the hair is stuck to the scalp, and you will not be able to run your fingers through the scalp because it will be thick hair. It will be thick and matted hair. It will be stuck to the scalp. So, and now we wanted to discuss about lycopodium also, where again, lyco will not be having the orphaned feeling. Lyco does not have that early responsible feeling also, but then lyco will be very timid, and it knows that its parents are having some turmoil and they are into quarrels. Lyco will be having that grudge. Okay, when I grow up, I will beat my wife like this. Is the lesson what a lyco learns. How my father is beating my mother. Okay, Lyco will be timid. It cannot object his father. It will rather go into the room. It will not even help its mother. It will go there and watch the entire scenario. Why? In Lyco, that early psychosis is there, no? And it will know, okay, now mother is submissive, and how father is behaving like a king. Okay, so tomorrow I will grow up like my father and I will beat my wife like this, etc., etc. Will be the picture going on in the young Lyco, love of power, no? Love of power in the young Lyco mind. And will it take care of its mother or will it take care of its father when the Lyco grows old? When the Lyco becomes the head of the family, this Lyco child will ask the father, you did like this to me when I was 5 year old. I asked for a chocolate and you never gave me that. I wanted to watch a TV program and you did not allow me that. So this Lyco will be 1, 2, 3, like that. The Lyco will be talking back to the father and it will be producing all the grudge. Now you suffer. I am not going to give the remote to you. The father will be already into some neurological disorder, some Parkinson's he will be having, some Alzheimer's he will be having. But then this Lyco will not be having that. It will not come down. It will be only like that love of power will be enjoyed by the Lyco. How will the Lyco child behave? By one word, by kicking. By kicking. That is the best picture of the Lyco child. Kicking the hard on inferiors and soft on superiors, right? In the front of the superiors, it will be keeping mum. It will be only staring. And when it gets chance, like mother or maid or somebody like a milkman, for example, the child knows that he is only a milkman. His job is only to drop the milk in the milk box and go. He is not educated. All these things the child knows. And monthly once when the milkman puts the doorbell to collect his money, this child will go, and what he will do? He will go and give him a kick and come back. This is the Lyco child. If it is a Casanos time, what he will do? Good morning, uncle, the child will say. If it is Belladonna, how he will behave? Good morning, uncle, and it will do a march there, left, right, left. Because Belladonna is playing antics, but then that will be a good play, good antics, and that everyone will like a Belladonna child. If it is a Hyoscyamus, again there will be playing antics, but it will be a bad, some sexual thing. He can go and do something bad to that person and come running and hiding behind the mother. That will be the Hyoscyamus playing antics. We will be irritated with Hyoscyamus antics, and we will like the Belladonna antics. So now here the poor child's primary reaction of weeping and pleading to the hostile stimulus of parents' fights has failed. He mentally shifts his gear of defense. He is as if orphaned. He decides to grow on his own. His second defense of psychosis switches on. Yes, he becomes precautious. He becomes too much matured for his age. At the raw age of 7 years or 8 years, he starts having all the qualities of an adult. He starts advising his mother about how to behave and how not to, and very often right. His decisions are mature. He stands first in his class. Immense intellectual capacity. This may go to the extent of the child being recognized as a child prodigy. All his faculties are well developed. Even the sexual maturity or the interest in sex develops too early in childhood. He may start hugging and kissing, touching the breasts of mother, maids, or even other ladies, which may go unnoticed for his age. The Oedipus reflex of children prematurely matures into sexual affliction. Hope you have understood the scenario. So this will be very true. You would have seen such children. Yes, even they will be sitting in the lap of lady teachers, and they will want to have some kind of a fondling kind of a movement, a caressing kind of movement. All these things are sexual enjoyment. Even without the knowledge of the teacher, the lady, all these things will be happening. Yeah, that is again early maturity, precocity. On the other hand, physically too, he starts growing. He suddenly starts putting on weight. The face and the body acquires rounded contours. I shall give an example here. There was a child who was very puny, very lean, and a nice child. He was having bilateral tonsillitis, okay? And it was kissing tonsils. It was so huge, it was like hypertrophy. That is bilateral hypertrophy tonsils. And at that time, I had tried with many medicines, and the parent became impatient of the treatment, and they took the child to surgery. Okay. Once the child had some high fever and the fever did not subside, etc., etc., and they have taken the opinion of pediatrician, and what they will suggest, they will ask to cut off the tonsils. And the child did the same. What happened? That this child was having that kind of a noise producing in the sleep, something like the child will be producing this kind of a noise because of the improper breathing. The child was not able to breathe, and the child was having some irritation in the throat, and this child was constantly making this noise. So the parents are tired of this noise. After the surgery, what had happened? The noise is still there. The tonsils are not there. The tonsils are removed. The throat is clean. The child is able to swallow well. The child is able to breathe well. There is no mechanical obstruction. But still, the child is not sleeping properly. Every time in the night, the child will be producing this kind of a noise, kind of noise. Okay. And again, the parents brought him to me. Doctor, even now that sound is not gone, which means there is something else in the child. The parents realized that for the first time. Why was that? Of course, the parent was a very intimidating kind of a parent. That is another story. But then this child, I could not even recognize the child. Why? He was a very puny child in the soric phase. Now his psychotic defense, that was right in the throat. The irritation, the constant irritation has now gone into the psychosis, and this was his psychosis. Somehow the child was surviving, and that is also removed now. And this child is now into full-blown psychosis. His face was roundish, and he has gained weight suddenly in 1 month time. So the child was storing all the psychosis or all the sadness or all the delusion criticized or whatever the child's delusion was, the child was storing everything in the throat in the form of the hypertrophy tonsils. When that was removed, it became a full-blown psychosis. The child became sexually matured. The child became gained weight, and he looks like a young man. Yeah, the childhood is lost entirely. The childhood is lost. This is how you can see the difference when the child goes into early maturity. Suddenly there will be the gaining of weight. There is no time limit for that. Suddenly, in 1 month time, the child can put on weight, rounded face, etc., etc. What does that mean? That is the next paragraph. Page number 137. The child has shifted from Sora to psychosis too early in age. Such a child loses its childhood too early. He prematurely matures into an adult. The pity is that the child has skipped one phase in his life. He may be soon diagnosed as suffering from diabetes. Doctors diagnose this as juvenile diabetes, the childhood diabetes, and declare it as congenital or genetic. This is not true. This is neither diabetes insipidus nor due to genetic, just a minute. This is neither diabetes insipidus nor due to genetic aberration. This is early onset diabetes. The child who used to suffer from psoric or inflammatory and infective diseases like viral rhinitis, bronchitis, or recurrent diarrhea does not suffer from it anymore. Suddenly, his tendency to take infections seems to have vanished. The diseases caused due to immune impairment in the endoderm is now suppressed to higher level or more important organ, that is pancreas. What does this mean? Generally in the psoric phase, children under the age of 10, 12 and all, what do they suffer from? They suffer from recurrent fever due to respiratory tract infections, upper respiratory tract infections, or they can even suffer from atopic dermatitis upon the ectoderm, that is the layer 1, or layer 2 diseases like rhinitis, bronchitis, etc., or even wheezing complaint, allergic asthmatic bronchitis, all in the second layer, okay? Or sometimes diarrhea, that is the endodermal again, second layer, diarrhea, frequent diarrhea. That's all, not the diabetes and all. But here what happens, they go into, the sora is compromised and they go into early maturity, and they will be having, they can even, the hormonal layer will be affected, the pancreas will be affected, and they can go into juvenile diabetes. That is nothing but the diabetes coming on early. That is early onset diabetes. The type of defense that is the miasm has also changed from sora to psychosis. Either it starts chronic inflammation of the pancreas or due to arteriosclerosis setting in too early to block the blood supply to islets of Langerhans in pancreas. Anyway, some pathology happens in the pancreas and it will be stimulated, yeah, to suppress the insulin. So the glucose level will be high, early onset diabetes. This is a story of the unfortunate children who sacrifice their childhood and prematurely mature due to the immaturity of the parents who are solely responsible for their child going into the psychotic excess. Very sad it is. There are other groups of children who suffer from different fate, the fate of psychosis less. So all this time we were talking about psychosis excess. Now we are going to psychosis less. Any doubt till now? Can we proceed with the reading or do you want any discussion? Can we go to the next page as well? Yes, all good. So what is the psychosis less? We have seen some children come to us for bad performance in the school, bad performance in the schools. The story is very identical. Until the child was in the 5th grade, the child used to score well in all the subjects. He was considered to be one of the brilliant students. Only his health would not permit him to pursue his studies well. The child is always number one, but then physically the child will be very weak. Always he falls sick. He used to suffer from recurrent asthmatic bronchitis. He did not respond to antibiotics and so was put under homeopathic treatment which acted like a miracle. His attacks have become much less, as almost non-recurring. Body may or may not grow, but his performance at the school has gone down after the homeopathic treatment. He has started getting easy fatigue. His he sleeps or at least needs sleep of 10 hours or more. All these things are signs of physical weakness. This is all psychosis less. It is difficult to awaken him. These children cannot score good marks in mathematics or languages, but do very well in science, especially scientific experiments. They do become expert in handling electrical gadgets. They can even repair them. The mind works good in machines, computers, etc., but cannot comply with studies. Very often, they are even stamped as dyslexic. Physically, the child does not grow in height. He becomes broad but stunted. Bony structure becomes prominent. In such cases, the right brain may grow, but left does not make progress. Sensitivity, creativity, imaginations show tendency to growth, but are brutally covered up by psychosis. There are some cases where the opposite happens. Creativity, imagination take a back seat. The left brain dominates, and growth can make him a good leader and ideal businessman at a young age, but school studies suffer. These different aspects of selective growth retardation needs to be considered while arriving at a simillimum to cure. What does this mean now? This is all about our psychosis less. So in the psychosis excess is a little more obvious, whereas psychosis less, you need to have that extra antenna in order to find out the psychosis less. You will think that, okay, this child is rather contented or rather taking a very low profile. The child who was scoring very well until the fifth standard or something suddenly started behaving in the opposite way, like does not want to go to the school, does not want to mingle with the friends, or the child is having some timidity, some fear, some insecurity, which has gone into the next level. In the soric phase also there will be insecurity, timidity and all that, but then the child will somehow go on and on. How it will be shown in the physical ailments like fever. Every time the child will be having fever. And before every exam, the child will be having an asthmatic bronchitis. Before every stage performance, the child will be having some diarrhea or some stomach infection, etc., etc. All these things are the soric defenses. Because the antibiotics did not work, the parents have now brought the child to a homeopathic care, and we have given some XYZ medicine which happened to suppress the soric miasm. And now the child had to grow into this is just like the surgery. Suppression is just like the surgery where the tonsillectomy had happened and the child has grown into compromised sora and grown into psychotic excess. Similarly, here, after the homeopathic medicine, the child does not have any asthmatic bronchitis, etc. But there is frequent fatigue. Again, the child is not going to the school regularly. Why? The child is always tired and the child is having very less concentration, poor concentration. Child's interest is now going more towards the gadgets. The child does not have that interest in the school. So all these things are picture of psychosis less of memory power, not able to concentrate, etc. So here you will have to take the JOD, yes, the journey of the disease, and write down layer by layer. And from when did the child start shifting the gear? That is the exact point what you have to find out here. The above predicaments of a child are seen to be precipitated very often in children wherein either of the parent is very strict. Yes, if the parent is very strict, the child can go into psychotic less also. A strict father beating a child often to induce discipline is countered by the sensitive child first by weeping. When weeping is of no avail, the child decides to stand up to the torture. He acquires the second defense and becomes thick skinned. Come on, beat me as much as you can. I shall never show you that I'm hurt, is the silent revolt. These sensitive children get hurt, but cover it up, do not show. They hide their feelings and then go and weep in privacy. We can literally see the eyes flooded with tears, not allowing to be let down. Which is the best medicine? The glassy eyes, Ignatia and Natremure, yes. Their skin gradually becomes dry. Their palms almost show corny thickness. Their hair becomes dry, rough, and curly. Their hair are difficult to comb and are short and compressed like a cap to the scalp. All these are ample evidence of lost childhood, lost love, fear-filled life. Magnesium group, Natrum muriaticum, very often have such hair. The hair that is stuck to the scalp, and it can be curly also. Why is it so? Because of confusion. Because of confusion of identity. The hair can go curly. As all these lost childhood, children grow up. They start various acquisitions. Some children buy perfumes. Some of them share luxuries and luxurious products, and some develop sex as the prerogative. So this is how the child goes into the not the normal psychosis, but the as a defense, as there is no other go for the child than to go into the psychotic excess or the psychotic less. So that is all out of the channel. All these are not normal psychosis, but then these are kind of abnormal psychosis where the child was pushed into psychosis, compromising the sora. The child did not enjoy its childhood fully. Even before that, the child was pushed and sent off into the psychosis. So how many of you parents do that to your own child? Hmm? You have to learn dance. You have to learn singing. You have to learn how to be on the stage, how to present on the stage, how to do the elocution, etc. And you have to be the number one also. At the same time, from the sixth standard onwards, you have to go for the coaching class, JEE, NEET entrance coaching class. You have to go from the sixth age onwards, and you have to go for this, that, and all that. No, and we all are pushy parents. I know we all are pushy parents, and all our children are having early maturity, early psychosis and all that. We are seeing that regularly in our clinic, and this is the normal norms now. Every parent are pushy parents, and the parents themselves are also striving for more and more better and better results, and we are all achievers. Okay, forget about that. But then at least the children should not go into out of the channel into the syphilitic. You have to give that quality time to the children, and how to take care of the mobile phones now, how to take care of the gadgets now. You should be an example to the children. That's all what you can do. So when you're watching a reel or something, no, maybe you can take the help of your child, or you can sit with the child and watch the reel that he is watching, and you can show the reel that you are watching. So this will be kind of a quality time, or this will be through the mobile phone, through the gadgets, because we cannot do without gadgets. First of all, accept that. You all will go on strike. No, I will not use the mobile phone. It's not possible, guys. It is not possible. One or the other gadgets will be always fitted on your body. Accept that first. And the child also, as long as you are fitted with all these machines, all these gadgets, the child also will be fitted. No, you cannot dictate rules to a child. Don't use the mobile phone. Why? You are using the mobile, no? So you can always watch the mobile together. Yes, you have to wear that kind of a protective glass. That will be the best method in order to reduce the radiations. And you can sit and talk with the child, share some music or some songs or some reels or some anything, something, some soric things you can watch there. Okay. And you can exchange the soric emotions there with your child. This will be one quality time, yeah, which you can have with your child. Some 5 more minutes left. Any quick discussions or any inputs from your side? Shiny is asking something. Perianal vitiligo. Oh my goodness. In a child of 4 years. 4 years means what? The child does not have an emotion of its own. No? The child is only 4 years. No, so you can always ask about the mother. Where did she undergo that kind of a despised feeling? That kind of a put down feeling, very low feeling, a shit feeling. Yes, Adria was saying that. The shit feeling. Where did the mother have that feeling? Kind of a similar feeling will be there for the child also. So you can always interrogate the mother for that. Merck's hole. Of course, yes. But then don't directly jump into the medicine. Better to take the case in detail. If it is Merck, give Merck. Of course, Merck is the syphilitic remedy, right? So here, vitiligo is also a syphilitic miasm remedy, miasm, syphilitic miasm. But then you want to know the cause. Why did the child develop that? So that point you will have to convert into rubric. Gave 1 dose, Merck 200. Very good remedy to begin with. Yes, Shiny. Just observe it, okay? Don't change the medicine. The child is defiant. Yeah, don't change the medicine unnecessarily. Just wait and watch. At least for 3 months, you patiently wait. Yes, the child is defiant. And perianal region is where the mucocutaneous junction also, no? So Merck will be one of the best remedies, and acid night can be another syphilitic medicine where you can think of, but then that should always match with the emotions of the mother.
Ma'am, it is there on the buttock region also, both sides. Anal, that anal opening surrounding buttock region. It is not in the anal, that, what is that? That
Not in the
area it is not.
mucocutaneous area.
No,
It is
no, no.
only
It
upon the
is on
skin.
the buttocks.
Only upon the skin, yeah. So anyway, you can interrogate the mother since the child is so young. Okay. Anything else? All good? Because cases, current mental state is important. Current mental state is important. Yes. History is also important. Current mental state, of course, you want to know, no? When was the first menstrual cycle? When was the menarche happened? Did it happen at the right time or not? If that did not happen at the right time, you can even interrogate the mother. If the menstruation, the first menstruation, menarche happened at the right time and the child was having the menstruation regularly, then it is kind of secondary. That which means when did you, until what time did you have your menstruation regularly? When did it start going abnormal? When did it start going suppressed? From that time onwards, you have to study the mental makeup of the child or the thought process of the child. What was the increased demand for the child, like from the society, from the teachers, from the parents? Through the studies only, no, mostly it comes, mostly the history will be like this. Up to the 10th class, the periods was very regular. And from the 12th standard onwards, it started getting delayed, or from the college days, it started getting delayed. If the mom is phosphoric acid, can the child be chamomilla, who is very obstinate and weeping always and cranky? In the acute phase, it can be chamomilla. Acute phase, any medicine can come on. Even if the mother is phosphoric acid, if the husband is an axomica, then the child can be chamomilla, no? Can be. The presentation of the child will be again in the irritated manner. Very often I have seen, like, if the parents are calcaria, the child also will be a calcaria. If the parent is calcaria sulf, then the child can be calcaria carb or something like that. That I have seen very often. Husband is sulfur. Yeah, the child can be chamomilla in the acute phase. Thank you all then. I know you are all thorough with the subject. You are all getting more and more thorough with the subject. And as far as possible, we are discussing the materia medica then and there, and the rubrics, possible rubrics then and there. And we have got little more to finish the psychosis and then go into the syphilitic and all. It will be much more interesting. Vijaykar sir has put everything, pen down everything so nicely. So let us inquisitively go through all those things with lot of interest and enthusiasm. So let us call it a day. Bye, dears. Love you all. Have a great practice.
Thank you, ma'am.
Be able to tackle all those difficult cases. Present your case here. Post your positive results here. Okay, dears. Bye then. Take care. Love you
Thank
all.
you, ma'am.
Thank you.